Well, it's the last week of National Breast Cancer Awareness Month, and this morning we're looking into the procedures performed after a diagnosis. Just so you know, every year more than 100,000 women in the U.S. get mastectomies. I sat down with a surgeon to talk about the options that are available post-surgery.
It used to be more in the 50 to 60 range women, but now we're seeing a lot of patients in their 30s and 40s.
And in many ways, the roadmap for care hasn't caught up with this concerning trend.
Unfortunately, the mammogram age is still at 40 for most women, so the younger patients are typically presenting when they feel a mass, as opposed to those over 40 that typically present. They can also present after feeling a mass, but typically present with a mammogram finding.
Younger diagnoses and higher stages of cancer mean patients have tough decisions to make about their care. So, more younger women are opting to remove one or both breasts entirely with mastectomies.
We see both. I think there's a couple different things that pertain to that choice. Some is genetic testing. So if somebody has a genetic mutation that predisposes them to getting breast cancer, sometimes it's a better option to choose a bilateral mastectomy to lessen their risk when you know the risk is there.
The American Society of Plastic Surgeons reports about half of cancer patients who've had a mastectomy choose to have breast reconstruction surgery after. I asked Dr. Curtis about how many of his patients make this decision.
I would say probably about 80 to 90%. We have options both for implants and tissue-based options.
Medical improvements over the years mean better options for patients.
And the implants we have now are a lot different than the implants of the 80s and 90s. They're solid gel silicone implants. Their leakage rate is a lot less than it used to be, and they're safe options for women undergoing reconstruction.
Some really important information for you there. And it's not just relevant to women, by the way. Dr. Curtis tells us how he performs breast reconstruction surgery on men who've had breast cancer. Later this morning on Today in St. Louis, I'm going to have much more on why men are typically diagnosed with higher stages of the disease as well.